Okay, so we are going to start. Welcome back, everyone. We will now begin our lunch panel session on the ethics and policy of AI. We would like to again thank our meal sponsor, Baylor College of Medicine, for their support of the session. I'm pleased to introduce our moderator for the session, Dr. Peter Stone. Dr. Stone is the Truchart Foundation Chair in Computer Science and a University Distinguished Teaching Professor in the Department of Computer Science at the University of Texas at Austin. Dr. Stone?
Great, thank you very much. It's a pleasure and an honor to be here at the TAMEST meeting. We'll try to be your lunchtime entertainment. I'm joined on stage with some veritable AI experts, people who work with me here at UT Austin in an initiative that we call Good Systems. We have a relatively short time, and I do want to leave a lot of time for audience interaction. So rather than sort of doing long introductions or and having long opening statements, we're going to just launch right in. But I do encourage, I will be happy as moderator to sort of get people into the mix early on if you want to catch my attention. We don't have a deep agenda that we need to get through. But we do have on stage Matt Lease, Sherri Greenberg, and Craig Watkins. All of us are involved in an initiative on campus here at UT Austin called Good Systems. I've been myself doing research in artificial intelligence for more than 30 years. As Chris Urmson said earlier, from before it was as cool as it is now. When I first got into the field, we knew that we would need to sort of keep up with the times of science fiction, because everyone would ask, if you're working on AI, they'd always have the associations with science fiction. But I never knew that we'd also have to keep up with the times in sort of social science, public policy, and ethics. That wasn't the case when I first started. But now it really is, because of the impact artificial intelligence is having broadly across society. And when I say artificial intelligence, by the way, we had the great talk from Sweri's perspective on it, and also Robin's talk, reminding us that it's not just the latest shiny thing. That's not the ChatGPT that's artificial intelligence. There's many different technologies that come together that make artificial intelligence. But because of the impact it's been having, we've needed to think about the societal implications. I think it's now incumbent on all of us in the field. And so that's what prompted the launching of this grand challenge on campus called Good Systems. And so I'm going to lead off by just asking each of you to, first of all, introduce yourself briefly, and then say, what does it mean to you, the title of our panel, what is the Good Systems approach to ethical artificial intelligence? So let's start with Matt, and then Sherri and Craig.
Hi, everyone. I'm Matt Lease. I'm a professor in the School of Information here at UT. And when we talk about ethical AI or responsible AI, there's a lot of different aspects that go under this umbrella. Two of the ones that I've been most focused on is thinking about what we call transparency, interpretability, explainability, the notion that we should understand something about how these models work in order to trust them and work them effectively. And fairness, that when you deploy these models in the world, you want to make sure we're not having disparate impacts on different groups of people, particularly groups that are potentially disadvantaged. So the approach we've taken in this campus effort Peter calls Good Systems is to try to think about societally important problems where AI could potentially help, and also use those societal important problems to drive research on foundational AI that's more generally broadly applicable. So the project I'm leading is particularly looking at the spread of disinformation online and all the issues and challenges we have around that. So we're trying to help professional fact checkers do a better job checking all the stuff that's out there, but there's way more sludge on the internet than these folks can sort of ever get to. So one challenge they have is how to prioritize their very limited time. And here you can think about a fairness consideration, because if you're choosing among all the things that you could fact check, who's going to be impacted by different things? Are there some groups that maybe it would be a larger number of people would be impacted or benefit from checking? Or in this, it's a smaller number of people, but that's a vulnerable population. So there's fairness considerations about how we prioritize, say, a scant bit of human resources. In terms of transparency, we're at a time right now when a lot of people don't trust CNN or they don't trust PolitiFact. to give them reliable information. Who's going to trust a black box AI model telling them fact versus fiction, right, in this case? And now that's end users. We're thinking a lot about the professional fact checkers. They're our stakeholders. What are the kinds of things that these domain experts, they're not experts in AI, but they're experts in their particular area of work, what do they need to know? What do they need to understand about an AI technology in order to work with it effectively and actually integrate it into their work? And we've seen hundreds of papers in my research field where people are trying to automate fact-checking, and it's almost not used at all because it's not what the stakeholders actually need, and nobody's bothered to try to design effectively for them. So we're really trying to understand how we co-design effectively for stakeholders to make sure we build the things they can actually use and benefit from.
Thanks, Matt. Sherri?
Yes, thank you. A pleasure to be here. I'm Sherri Greenberg. I'm a professor at the LBJ School of Public Affairs and Assistant Dean for State and Local Government Engagement. I also have the great honor of being chair of Good Systems right now, and am very, very grateful to all of my colleagues who are so devoted to this effort. My interest in technology policy goes back 30 years, and it's really been one of the very first and foremost interests in my research. And it has progressed along the years. Peter, you mentioned science fiction. Something that always comes to my mind is the Jetsons, right? I feel that when I was a child, I didn't like the Flintstones, but I loved the Jetsons, and it's playing out today right in front of our eyes. What does that mean as far as good systems? I think with good systems, we are not just multidisciplinary, but we're interdisciplinary. We have disciplines from communications, computer science, engineering, policy, and others all working together because we know that there are risks and rewards with any technology. As Peter said, it's not just a shiny new toy. How could you use different forms of AI? It's not just ChatGPT. And what are both the risks and the rewards? We don't want to stifle innovation. On the other hand, there was a few years ago a scam going around with elderly people. And my father got a phone call. And the phone call was that his grandson was in jail in Nashville, Tennessee. Well, he called me up, Sherri, yes, Dad. Jordan's not in jail in Nashville, Tennessee. And I said, no, he's sitting in a classroom at McCombs where he's getting his MBA. And he said, well, that's what I thought. Now, today, that scam could be my son, my oldest son, Jordan's actual voice, right, calling my father. What would he do? Would he have called me? So there are risks and rewards. And I think from the policy standpoint, we need to look at the governance, policies and regulations, because they're not the same. You can have regulations, which are law, and policy, which is, let's say, internal to your organization. And how do you govern and implement artificial intelligence? One of the specific projects I'm working on right now is smart hand tools. What does that mean, smart hand tools? It means that there are applications with AI where it is the robot assisting the human, and others where the human is assisting the robot, right, Peter? So with smart hand tools, what we're looking at is, we know, and all of you know this, that we have a shortage of skilled workers in the skilled trades. How, for a welder, for instance, or for someone who's in the medical field, could we have AI assisting them with handheld tools, actual tools that they're using in their hands? What does this mean for the workforce? What does this mean for privacy? What does this mean for equity and for workers? Those are just some examples of the challenges, issues, risks, and rewards that I think we deal with and are dealing with, maybe not to the extent that I would like, in society today.
Thanks, Sherri. Craig.
Absolutely. First of all, thank you for the invitation to be here. So I guess I too have been involved with good systems from the very beginning, the early days, primarily as a researcher and not so much on the executive board. The sort of two questions that kind of sit at the heart of good systems that have always piqued my curiosity. One question is, what constitutes a good system, right? An artificial intelligence-based mechanism or procedure or process of some kind. And so that's both a technical question, right? Does the system work? Does it perform? Does it deliver the task that it's been built, designed, or engineered to do? And then the other question, right, is how do you build or design or deliver that system in a way that has equitable impacts, across society? So not only does the system work, but who does it work for? And what values are reflected or embodied in the system that's being built, the problem that's being solved, via this, if it's a model or some other, technological procedure. And it's that last question, right? How do you build a system that's good, and how do you even define, right, what constitutes a good system, has sort of resided at the heart of a lot of this work. My work more specifically has focused a lot on the intersection between health and artificial intelligence. So we began a project a few years ago where we began talking to a diversity of children, for example, and their caregivers about how they were interacting with AI consumer-oriented devices in the home. And we were particularly interested, right, in trying to get a sense of, as AI becomes much more broadly consumed, as AI becomes a much more routine, sort of regularly integrated component in our lives, how does that impact or interact with different populations, their concerns, their needs, their lived experiences? That was something that we were particularly interested in. More recently, we've been looking at different kinds of health data sets, for example. Some of you might be familiar with the MIMIC data set at MIT. Some of you may be familiar with the All of Us data set out of the National Institutes of Health. But we've been looking at those data sets to try to understand, for example, can you develop computational models that allow you to understand what are oftentimes called social determinants of health, right? These sort of non-medical drivers that impact health outcomes, and how those non-medical drivers distribute across the population, which ones may be more predictive of a particular health outcome. In our case, we've been thinking a lot about mental health, behavioral health issues, women's health, maternal health, and really trying to sort of figure out ways to design models in ways that allow us to understand what are the predictive markers or signals that may be associated with those kinds of health outcomes. And then the other thing that I'll talk about, and something that we may get into a little bit more here, is this issue of stakeholder engagement. What we've come to understand is that it's not just enough to assemble, for example, computational expertise here at UT, social science or policy expertise here at UT. But if you're building a system that has real-world application, and most of you are likely doing that, right, insofar as you're engaged in the sort of health AI space, you're likely designing that system, right, for a care provider, or you're likely designing a system to address some specific health outcome or domain, cancer, heart disease, whatever the case might be. But to what extent, right, are you building that system in ways that are particularly relevant to and useful to the populations that you're trying to serve or provide, right, some type of assistance, with this particular technological intervention that you're developing. And so this issue of stakeholder engagement, right, bringing other kinds of voices into the process, what we may call, right, a much more inclusive design orientation to how we think about building these systems for a healthier world and healthier outcomes.
Great, thank you. So thanks to all three of you. So just to sort of wrap up a little bit, just this introduction to what the good systems approach is, I think hopefully it's clear it's a very interdisciplinary cross-campus group. You have people from different departments, 4 of them represented here, but there's others as well, including architecture and English and many different departments. And it's organized in a way of having some core projects that have been going on for multiple years. You've heard about AI in health. You've heard about smart hand tools, misinformation. The one I'm involved in is called Living and Working with Robots. And it's about if we're trying to get robots that are autonomous over long periods of time, how should they be sort of integrated into society? One of the case studies that motivates us is there was an autonomous food delivery company in town whose robots were using the bicycle lanes, and that was very upsetting to the bicyclists in town. And so the question of the questions we ask are not just what can be built with artificial intelligence, but what should be built, and how do we define what it means for a system to be good? How do we evaluate whether a system is good, and what are the best practices for designing good systems? And this all does come down to good for whom, who are the stakeholders, how do we engage with them? So You can learn a lot more about good systems online. But what I want to do, my model of a good panel is one where there's some disagreement among the panelists, and maybe even that draws the audience in. We haven't rehearsed this at all, so I have a couple of questions that we'll see where they go, and maybe we'll get to just one of them, maybe we'll get to both. But the first one is motivated by the discussion that started this morning. When Chris Urmson was talking about their Aurora system, and with documentation that there's driver errors that humans would have made that truckers wouldn't have made, that their autonomous truck wouldn't have made, and they can document it. That these are circumstances. People caused an accident, their autonomous truck wouldn't have. And I asked him the question, though, of course, what about the flip side? There are also mistakes that the autonomous truck would make that a person would never make. And so now, this comes up. These kinds of questions come up not just in autonomous driving, but also in healthcare. Like, there's mistakes that a doctor would make. There's mistakes that an autonomous AI system or an AI advisor would make. And of course, the flip side. There's the right decisions that they would make. So, from a policy perspective, from an ethics perspective, what is the point at which it becomes the right thing to do to deploy the system? To replace people, how much better should you be at people at a task that's mission critical, or that's where lives may be at stake, where it's sort of okay to have some AI-based system, and at what point would it become even the wrong thing to do not to deploy it? Like how much, at some point you might say that the trucking system is so much better than human drivers that it would actually be wrong not to deploy it. Let's see if this what kind of opinions we get on this from whatever perspective you'd like to take. Let's start with Craig this time.
Yes, it's a great scenario, and you're right. We haven't rehearsed this, so we'll see how this goes. I mean, in some ways, you could argue, for example, that I think most of us in this room are likely aware of what the U.S. Surgeon General has recently declared as a sort of an epidemic or a national emergency in terms of the epidemic of loneliness, behavioral health crises, rising rates of suicide. This recognition, right, that the need for mental and behavioral health care far exceeds the capacity of that workforce to meet that need and to deliver care. Hence, we're seeing, right, just the emergence of a number of different sort of technological solutions that are designed in part, right, to sort of address that gap, right? Rising needs for behavioral and mental health support, just simply a lack of capacity to meet that demand. So how could chatbots, how could AI, how could smartphones, how could sort of digital innovations in AI, for example, sort of bridge that gap? So so the scenario that you presented, and there are many other sort of, case studies as well, is literally happening right in this particular environment. And a lot of dilemmas, right, sort of emerge in terms of the readiness of these systems to deliver care, right, that's safe, that's reliable. And so what we're seeing, right, are a number of interesting experiments, for example, with large language models, obviously, right, things like ChatGPT. To what extent could they stand in, or to what extent could they respond to, emergency situations or this increasing demand for care? And what we're seeing, right, from a lot of the early experiments, right, is just a lot of mixed results. In some cases, these systems are able to respond in a way that perhaps can help someone navigate an emergency or a crisis. But in many other cases, right, we're seeing just the high levels of instability, right? Responding in ways that aren't quite appropriate. In some cases, responding in ways that some research, I think a recent white paper out of Harvard who did similar kinds of work like this, reported, right, that even some of the responses, right, that were being generated by these systems were actually borderline dangerous, right, or irresponsible in terms of how they were responding to some of the experiments that they were conducting using these large language models. And so it's a dilemma that you pose, right? And I think it's a space now that many are trying to figure out is there is a recognition, right, that these technologies can, in fact, help us respond to the growing crises. The question is, how do we do it in a way that's responsible? How do we do it in a way that's ethical? And that, right, it just involves so many different interesting questions in terms of how these systems get developed, how models get developed, how they're tested. As we all know, right, the training and testing data, the populations that are used to help us develop these systems. And to what extent, right, are they designed, trained, and validated in ways that might be responsive, right, to the diversity of needs and populations that exist? And so I think these are certainly some of the challenges.
So let me just follow up with a question. There's an asymmetry to some extent in public awareness of the good things that the AI system can do and the mistakes, right? And certainly, it doesn't make news when a person causes an accident on the highway, but an autonomous car that has an accident on the highway makes worldwide headlines. And I think the same thing. It's a much bigger news story if an automated chatbot mental health counselor says something dangerous, and that can swamp all of the good things that have happened. And again, when a human healthcare professional makes a mistake, it's not worldwide news. How should we wrestle with that from a policy and ethics perspective?
Yeah, I mean, I think it's a good point. And it clearly, right, sort of highlights this issue of trust. And so I'm sure all of you have had these every one of us in this room have had conversations where you're talking to people, some who may be more of a novice, others perhaps have more expertise. But there is just sort of a sense of growing anxiety and uncertainty about what all of this AI stuff is, what's coming, what's on the horizon. And so I think to some extent, right, how do you sort of reduce, right, quite frankly, some of the mistrust, right, that a lot of society feels about these systems, concerns about fairness, concerns about equity, concerns about disparate impacts, just literacy and understanding what's happening here. I do think, right, there's a lot of interesting research beginning to emerge around this sort of future scenario. Do we design this notion of augmentation versus automation? Mm-hmm. In other words, right, as you're thinking about some type of AI machine learning system that may function in the healthcare space, to what extent, right, is that system designed in some ways to augment? That is to say, to support, enhance, or strengthen the capacity of a healthcare professional to deliver more efficient, more effective, more data-informed precision care. I think that's what we all certainly want to see. But we also recognize, right, that there are entities, organizations out there who are investing in systems that are designed to automate, right, to sort of replace the human, right, who's engaged or involved in the process. And health is just a really interesting and sort of sensitive space, right, because of the sensitivity of healthcare, the high-touch nature of healthcare, the life and death circumstances of healthcare. And to what extent are we comfortable, or will we ever be comfortable, with machines being the primary or sole decision maker in those kinds of situations? And I think that's really part of the tension that we're trying to work through.
Great, thanks, Craig. And so I'm going to pass it to you, Sherri. And I didn't push Craig on this as much, but I'd like, especially from your policy perspective, to take if you can, take a stance on, how are we doing right now with regards to policy? Are we being too cautious, or are we being, should we be more, or should, are we being the appropriate level of cautious, or, where are we, and is there too many opportunity costs in this?
Sure. This is actually not a new dilemma. We go back to the first industrial revolution, right? Mm-hmm. There were many concerns about what it would mean for society. There were policy issues that were not addressed. Eventually, we got child labor laws, right? That was a policy that evolved. So in many ways, these are not new questions, but new technologies. I do think it's important. I've done a lot of work with AI in the spaces of housing, homelessness, healthcare, some of these areas that are particularly sensitive to people. But with all of it, I think it is important, to the extent that we can, to co-create, use human-centered design, have feedback loops. And that's not enough. That's absolutely not enough. Why do I say that? I say that because there are perils, right? There is, again, risks and rewards if we go back to the opportunity cost. So if we look at healthcare, there are diseases that now, with AI, the AI can detect a disease that someone had that, frankly, humans never would have been able to suss out, right? Do we want to stop that? I don't want to stop that. Probably you don't want to stop that either. On the other hand, as Craig illuminated, there are situations, and we're seeing it right now in hospitals with AI-enabled robots delivering medications. Okay, humans can make mistakes. You could have a human deliver the wrong medication to the wrong person, right? It happens. If a robot does that, what are the consequences, right? And we see this too in all kinds of other areas where, again, with the driver, we know that most humans, I'm sorry, are not good drivers, right? Just look at the number of accidents that are car-related. Again, though, if we have an AI-related accident, it does make the headlines. So the question becomes, how do we initiate policies and regulations that instill that trust that people need to have, a baseline level of trust, without stifling the benefits? During COVID, I was the graduate advisor for our graduate students at the LBJ School of Public Affairs. And I'm here to tell you that there certainly were not and are not enough mental health resources, right? Would I have been comfortable turning my students over to a bot for mental health assistance? On the other hand, I'm seeing real-world applications in that area now. Unlike social media, I do think that we do need some regulations and policies now to try and at least instill trust, have some privacy, transparency, and accountability at a baseline level for those worst case scenarios, and to allow the benefits to proceed. I do not think we did that with social media. The President's executive order has a lot of areas for a lot of federal agencies to be exploring. There are other countries, though, and entities, whether it's the EU or other countries in the UK and others, who have taken a step to at least have some baseline policies and regulations. And I do think the time is now.
So just a quick follow-up as well on this is there are people, some of my colleagues, saying that AI technologies should be assumed to be guilty until proven innocent in some sense, that we should assume they're dangerous until you can prove that they will never make a mistake. Is that too high a standard?
I don't think that you could prove that anything will never make a mistake. If you ask me, is something perfect or will it ever be perfect in any realm, my answer is no. So I don't think that we could, first of all, you're not putting it back in the bottle, right? Genie's out of the bottle as far as AI. And I don't think that we will ever have perfect. However, I do think we could have good, and I do think that we need, again, yes, with good systems, this is what we're all about, to have those governance models, policies, regulations, and implementation to at least foresee and have a baseline for the consequences that could be extremely detrimental. I mean, so what am I talking about? Well, I'll tell you. If you ask me, what's your AI nightmare, Sherri? I don't remember my dreams, but if I did, it would be AI being deployed on the battlefield with AI-enabled robots making all the decisions themselves. Okay, that's not where I want to go. That's kind of a case study baseline example of someplace where I think we need regulations.
So maybe not perfection being the standard, but at least some demonstration, right? That there's been an effort to understand, right, where are the likely sort of deficiencies, or where are there issues in terms of equity, disparate impacts. At least some attempt to devote some attention to that and sort of demonstrate that, right, in your documentation of the technologies that.
So that's suggesting that an empirical approach of let's see document how many mistakes they would make, as opposed to let's prove that it can never make a mistake.
Right.
Well, and from the equity standpoint, you're going back to the algorithms, right? We know that bias occurs given the data that's being put in, or everything that's being scooped off the internet, because of course everything on the internet is correct and equitable and not biased, right? So yes, there certainly needs to be data informed and empirical, given these situations that we know of now or that we can foresee.
So Matt, do you want to add something on this topic, or do you want to take first crack at the next topic? Up to you.
Happy to keep going since we got some train of thought here.
Sure.
So We can think about when we have any status quo and we're considering a treatment or an intervention, what are the measures of success we're going to look at? And we might say that there is the mortality rate is lower overall, but sort of it's distributed differently. You can frame that question and think about whether it's appropriate to use that treatment and when without talking about AI or technology. So I think a lot of these conversations are ones that get framed in terms of AI because it's so much in the news today, but are kind of broader things and things that we've thought a lot about in sort of other areas before this. I think it's also interesting, we're up on the stage and sort of being asked to speak on these issues, but who are we sort of to decide the stuff? I think these questions are not for the computer scientists to decide, but sort of for us to decide, as a society, which is sort of why in this good systems thing we're trying to do this stuff together. But I still have responsibility. I'm a computer scientist by training. I need to take responsibility for the things I build and put out there in the world. And I think that's one of the challenges we have is thinking about what is accountability. If there is this sort of accident, is it the company that's responsible or the programmer? I think fields like engineering, civil engineering, are much more mature in how they think about these sorts of accountability, liability issues in ways that we haven't sort of in the software industry. Peter asks about, could we just do a deployment and measure things? Well, that's typically assuming that we're doing a fixed deployment. But for anybody who uses your phone or anything, you're getting an update and a new thing all the time on it, right? So I think there's particular challenges we'd have to worry about in trying to map some of the ways that we're used to thinking about these issues sort of into the sort of current technology substrate. So I guess the last thing I think I'll say, kind of connecting to Sherri, I went to a prestigious AI conference back in 2017, and there was a panel of roboticists. And it just so happened at the news, at the time, there was a discussion about should we allow development of battlefield robotics. Some of you may remember there was this letter signed by 100 famous people saying we shouldn't do it. And I asked that panel at the time, what do you all think about the role you play in building these things? And the answer I got at the time was guns don't kill people, people kill people. I just build it, not my responsibility what people do with it. And I don't think you could ever get away with saying something like that today in a way that you sort of could back then. I think we really do care a lot about taking responsibility and thinking about the things we build and the way they're going to go out there in the world. But it's really complex and challenging. And we really need to sort of sort out, again, these accountability issues and figure out how we have these conversations where it's not just also me as a computer scientist making a decision, but sort of engaging with these other folks who kind of have a broader perspective and maybe some different training and kind of wrestling with these issues.
And Peter, given who we are and what you just mentioned about training, I do think that it's extremely important that we start at a very young age in our education system regarding these issues. A few years ago, I did some research on a research project, and we went out and did surveys and interviews with computer scientists who were developing AI in universities, in industry. We interviewed lawyers in universities, in industry, in private firms. We interviewed policymakers. First of all, none of them understood what each other did. This is not a surprise. The lawyers, what were they concerned about? Risk and liability. The computer scientists at the time were pretty much saying, because we gave them different scenarios and asked them about ethics and responsibilities, some case studies. The computer scientists were saying, not my problem. And the policymakers were saying, well, we want to make policies, but they had no idea what they were making policies about. And so I do believe that it is incumbent upon us to, and I know we are doing this at University of Texas at Austin and we'll continue to expand it, but to all of us to have education and frankly continuing education regarding these issues.
Yeah, I feel very strongly that these days everybody should be literate in artificial intelligence when they graduate from college, and also all technologists should be literate in the social and policy issues. So there's a bunch of things I could do from here if we had time. I'm tempted because we hear a little bit like some sentiment that artificial intelligence is just another technology like all the others. We've dealt with this. It's sort of not a new issue. On the other hand, sometimes coming into the conversations are the issues of existential threats, and I think we don't have time to go there. There's but there is a question of whether that colors the ethical and policy questions. If the risk of and I personally think that these are overblown, and I'm very much aligned with the idea that that it's that we should be dealing with artificial intelligence as a technology in the way that we have in many ways. That there's good and bad, and we need policies to steer them. Like I said, I think that would be a can of worms that would take a long time to deal with. The other maybe this will be a topic for audience questions. I'm going to open it to audience participation in just a minute. So if people want anything they want to say, think about it. But the other is, Matt, you're talking about sort of thinking about people needing to think about the effects of their technology and having a responsibility for thinking about how they can be used. This also opens a question of that's very topical today, is whether these most powerful generative artificial intelligence models should be open, or whether they should be controlled by the controlled. And I think there's strong. One of the arguments for them being controlled and closed is that if they're open, people could use them for all kinds of bad things. But there's also arguments on the other side. So does anybody want to have a quick response to this so that we leave time for questions, or should we just let the audience start weighing in on this?
Let them lead us.
All right, let's from there. Let's go to please.
I find the idea that we should use AI to deal with the mental health crisis deeply ironic, because there is very strong evidence, and we just had a congressional hearing about this. The mental health crisis is caused by technology, or at least it is a very major factor. So I just imagine Mark Zuckerberg going to Congress and say, don't worry about the AI crisis that I unleashed. I will unleash another technology to address it. And this is, to me, an extreme example of techno-utopianism, okay? We have a social problem, technology is going to solve it. Let's figure out, first of all, why do we have that problem? What did we go wrong? And I think where we went wrong is with the questions of who benefits, who decides. We know the answer to that. Silicon Valley benefits, Silicon Valley decides. Unless we are willing to deal with that question, all these other questions that you have raised are very, very important, but who's going to pay attention to what we are saying here? Silicon Valley benefits, Silicon Valley decides. Are we willing to do something about that?
Yeah.
That's, to me, the elephant in the room.
And this is very related to the question of should the models that Silicon Valley is developing, should they be open or closed? And so I think, so Moshe was pointing out that we could be over optimistic about technology because of this influence. I said the other way that it could be, we could be being over pessimistic and locking it down too quickly. What do you all think?
Yeah, so thank you for the comment. And generally speaking, I agree with you. So as someone who's followed that research that you just noted, who's also contributed to that research, there are sort of mixed viewpoints and perspectives, right, about the sort of direction of the impact. So we know that there's some relationship between mental health outcomes and the rising presence of mobile technology, smartphones, social media, et cetera. But exactly what the direction is, the broader sort of contextual factors, environmental factors, et cetera, complicates the question a little bit more. So let me just say that. I don't know if we necessarily have a choice in terms of designing these systems in ways that might be able to address and sort of reduce, right, some of these health outcomes that we're discussing. But your point, right, about who benefits, about who drives that conversation, who sort of defines whatever that invention or innovation might be, I think that is an important and compelling point. And part of the work that we're trying to do, right, is to bring other kinds of voices, other kinds of perspectives and expertise into what that future might look like. And so if the future is simply the Zuckerbergs of the world, Silicon Valleys of the world driving this, building this, defining this future, then I agree with you, right? It's likely a problematic future on the horizon. But if we can, in fact, right, create a different kind of process in terms of how these systems how we even imagine, right, how these systems might be deployed and service the populations that need them, that's a really interesting question. And the only other thing I'll say is I I do think we're in the horizon of sort of a new standard sort of emerging about how do we approach building these systems. So for example, in my space, right, in my colleague space here, as academics, right, so when we pursue grants, and we just got a grant, my team, from the National Institutes of Health, to look at for the suicide crisis among African-American youth, for example, and sort of trying to identify social risk factors that may be predictive, of those kinds of outcomes. But I think one of the things that made our proposal so strong is that we didn't simply say we were going to sort of just create like a dream team between UT and Cornell Medical School as the other partner in this project, but we also knew that we had to go out into the community and talk to people who were on the ground, talk to people who are experiencing the suicide crisis in a fundamentally different way than we are as academic researchers, technology developers, ethics, researchers, et cetera. And so the issue is, right, if we can bring that kind of perspective and expertise into the design and iterative process of whatever system gets created, whatever intervention, right, gets developed, that it's far more likely to be trusted, it's far more likely to be relevant, and it's far more likely to be sort of removed from those sort of the lens and the perspective and the motivations of the Silicon Valleys of the world. And so I appreciate your comment, but I do think that there are other pathways to get at a solution that would be much more effective and impactful.
I do appreciate your comment also when I made my comment about social media and policy, that we were asleep, right, completely asleep, and we should not, in fact, follow that model again when we're talking about governments and implementation and policies and regulations. And I very much appreciate that. On the specifics, it is a very thorny issue and question. And I do concur, having been on the board of and chair of a hospital district here that serves people of very low income, that the equity issue is huge. And as I used to tell my students, you can't just like go sit in the corner of your room and design an app and then wonder why nobody's using my app. Did you ask people what they needed, how they would use it? And so I concur that is many times lacking and critical when we take in the perspectives, when we look at the policies, when we look at what this will mean for the lives of people.
I don't think anyone on the stage is trying to say for every societal problem there's an AI solution. And if we gave that impression, that's mistakenly on us. I mean, I think there's important conversations being had about when we shouldn't build AI. So you might recall there was, when it came out that Google was selling technology that was being used in the military complex, the Google employees protested and Google discontinued that work. We have regulation in all kinds of sectors around developments where we want to make sure that things are developed and designed in responsible ways. And I think we're trying to guide them there. I think it's a very fair question to say, when I look at some societal challenge, is there a way that AI could be used effectively? Or if I use AI in this space, what are the downsides it might cause? I think those are good questions to have. I think we see that these developments aren't only happening in just the for-profit sector. So the Allen Institute for Artificial Intelligence is doing a lot to try to do open domain development of technologies that aren't driven by profit. And last thing is, I think, as we've heard a couple times today, we really believe that education is really important. So, Silicon Valley is not just a monolithic thing. It's people working in organizations. And the more we can do to help people understand and think about these issues and wrestle with them, I think the more we would trust that we can all kind of make better decisions as a society.
So we're coming up on time, and let's try to do some rapid fire questions and responses if we can. Let's go over here.
Great, thank you. This is a fabulous panel. The question I had was, there are obviously bad actors everywhere. The difference between a bad actor being a human versus a bad actor who is working on AI is the scale of impact and the time scale with which that impact can be had. So from a policy perspective, what would be your thought in terms of kind of restricting that? So it goes back to the discussion that you were having. Why does it make big news? Because you might have 10 trucks or 100 or 1,000 trucks all having hacked by somebody, all having an accident at the same time versus a single human being driving a truck, right? So I guess my question is the scale and the time scale of impact. So it might take, even if it is 30 seconds, you can shut down the entire like an entire industry, if you, even if they're, so yeah, I just wanted to hear your thought.
So let's say maybe one or two quick answers.
Rapid fire, I look at disinformation. There's a great article from Brookings about what happens if on election day there's a massive disinformation attack and we can't deal with it until polls close, this sort of thing. I think these are incredible challenges that we don't have good answers for yet.
And yes, I agree. Things go viral, right? It used to be that you wouldn't hear about something ever that was happening across the country, much less across the world. Now it goes viral in an instant. So very good point.
Yeah, so just a quick one. I'm bringing up an elephant in the room, and that's COVID. I mean, that really changed everything. Yes. And there's so many young people that I work with that were really affected by that and climbed into holes, and we had masks, which were really good for infectious disease, I want to say that. But it did change the way that people communicate, and I think that it's a really important aspect of the evolution of AI and how people are using it. And I think that you have to keep that in mind. It's really hard to go back to before COVID, but it's an elephant in the room. It really changed everything. And I think opinions have to change a little bit more about mental health especially. There is a human factor that cannot be replaced. There is just no way. And I think that that's something that we're realizing a lot right now. So anyways, sorry, that was maybe too long.
Quick response?
I would say yes. I dealt with that, as I said, directly with my students as graduate advisor. And there is a human element that did change during COVID in many ways. For some people who were introverts, frankly, they were more comfortable. For some people who were extroverts, they had a very difficult time. There were mental health challenges. And on the other hand, being with a hospital district at the time, healthcare, I saw something that had taken years of, frankly, just inching forward to go at light speed, and that was telemedicine and telehealth that really, for many people, gave them access to healthcare in an equitable manner that they hadn't had previously.
So maybe one last quick question.
You've partially answered, love the topics here. I want to second and then turn it into a question. Second, the need for regulation, because coupled with education, as someone who's about to catch a flight back to Silicon Valley this evening, the people who want to do the right thing need regulations to allow them to.
Yes.
Because if you work for a company, it is your job to maximize the profit of that company within the rules.
That's right.
And the way you change the behavior isn't scolding, it's changing the rules. And when the rules change, everyone that's very good at following rules will adapt. So I want to add a compliment and then turn it into a question. However, if all you do is regulate, and this is going to be an insulting caricature, you end up with Europe that is very good at stopping things from happening, much better than we are, and there's things that they're doing that we should have done, but as a result, there's much less creation happening there. So I guess my question is, in addition to policy things that say do less of, what are the do more of policy things? Maybe one quick thought from each of you that you'd also like to see.
Yeah, I mean, it's a great question and a great observation. We do know that more regulation is certainly on the horizon. You mentioned the executive order. There was an AI Bill of Rights a couple of years ago. So this train has left the station. Where it's going, we're not quite sure. But I guess what I would like to see, and some of this right is in the AI Bill of Rights and certainly in the executive order, again, is just trying to figure out ways to be much more inclusive about whose voice and perspective just is informing this conversation, generally speaking. And in our cases here, specifically right as it relates to this in the healthcare space. And so there's just so many other voices and perspectives, and we do research, and we partner with others who are doing research that go out into community spaces, community health clinics, the wide spectrum of healthcare workers who are out there, clinicians, non-clinicians, and really trying to see, right, if we get perspective from them, how might that impact, right, choices that we make with this technology? And if we can figure out a way to sort of build that into some type of regulatory apparatus, right, that incentivizes being much more inclusive, I think it will begin to address at least some of these challenges.
So what you're speaking of is reaching an equilibrium, right? Innovation versus a lockdown. And having grown up in a small business family, I am appreciative of the free market economy. And historically, looking back over the years at economics and self-regulation in various industries, it didn't work, right? And it didn't work for the employees either that you're speaking of. So we get back to how do we have a baseline of actual regulations, right, that help all of us and the employees without stifling innovation. Yes, that's the sweet spot.
So I'd like to thank the panel where I've been getting a number of warnings, if that's okay.
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 So thank you.
I was going to say something really
Go for
brilliant,
it.
but sorry.
Oh, well.
Yeah.
So Craig, Sherri, Matt, thank you very much for all of your opinions, and thanks all of you for your participation.